We also need to check the range of motion of the mandible. The first thing that I'd like to check is the maximum opening of the mandible, and we can do that with a set of calipers. There's lots of different types of calipers that can be used. These are just fairly simple ones. So I'll just get you to open as wide as you can, Sandy, and we're just going to be checking the maximum opening. And in this case, taking into consideration the thickness of the anterior, we're looking at around about 46 millimetres opening. So that's a substantial opening, and that's quite good. Doesn't indicate any temporomandibular joint dysfunction. The next thing that I'd also like to do is to check Sandy's maximum protrusion. Seeing that the Somnodent mandibular advancement splint is going to do just that, advance the mandible forward, what we want to make sure is that there's no discomfort while she's protruding. So just slide your jaw forward there, Sandy, as far forward as you can. There's no discomfort there at all. There's no soreness in the jaws, no soreness in the muscles. That's great. Just go back a little bit. That's great. Not so much, just forward a fraction. Just hold it there for me. We can keep Sandy in this advanced position, this protruded position, for a short period of time, just to see if any discomfort may develop. Just close up on your back teeth now. Once we've satisfied that Sandy is a candidate for that protrusion for the advancement splint, then we're quite happy to progress forward and have a look at the soft tissues. So the next part of our examination will involve our soft tissue screening. And what we're looking for here is a fairly systematic approach to looking at the soft tissue. The first thing I'd like to look at, just open up nice and wide for me there, Sandy, is the back of the throat. We're having a look here to see the uvula, the size of the uvula, and the tonsils, and the length of the soft palate. If everything appears normal and the airway is consistent, then as far as I'm concerned, we can continue on with the next part of our soft tissue screening. We can have a look at the size of the tongue. We can look for things like scalloping of the lateral border of the tongue, etc. We're also going to be doing an oral cancer screening. We want to make sure that the patient doesn't have any signs of oral cancer, which might be irritated by any form of appliance that's placed in the mouth. So we will have a look at the buccal mucosa, the mucosa on the inside of the lips. We're also going to have a look at the floor of the mouth. Next thing that I also like to look at is the lateral border of the tongue. So Sandy, if you could just poke your tongue forward, that's great. What we're going to do is just examine the lateral border of the tongue and just turn way over this way. That's great. And making sure that there's no signs of oral cancer. And that should complete basically our soft tissue screening. We'd also like to do a periodontal assessment and periodontal examination to make sure that there are no signs of periodontal disease. As part of our overall examination procedure, we'd like to have a look at the overall oral health of the patient. This will include things like examination for carious lesions, and will involve bite-wing radiographs, etc. for interproximal lesions. So really we're just looking at the overall oral health of the patient, which we would be normally doing as part of our clinical assessment for any patient.